Health is a major commitment for government to fulfill. This actually requires adopting innovative financing strategies, enhancing coordination between ministries of health, finance, education, and this is to mention but a few, as well as ensuring there's efficient and transparent spending of the allocated funds. Now, we are wanting to track Uganda's journey in achieving this equitable health for all, and my guest this morning, Richard Muganzi, Director of Programs, and this is with the Center of Health, Human Rights and Development, also known as CEHAD. He's joining me to give you a breakdown of what it means for you to have a right of health and to enjoy that right of health. Mr. Muganzi, good morning to you.
Yes, good morning to you.
It's a pleasure to have you with us.
I'm grateful too.
Now, I know that CEHAD has been in the business of focusing on advancing and realization of right to health for the last 15 years. Many of us have had this right to health, and it always comes about when we look into a holistic life and what are some of the key primary areas that people should be looking at, and the word health always comes up. But for us, it has always come up in the perspective of, am I breathing? Do I have any conditions in my body, any ailments and things like that? That's when we think about health. And yet I know that it stretches way before that. So talk to us and help us understand, what is a right to health?
Well, thank you very much, and good morning to you all our viewers. In the first instance, we have to understand what health is. And health is that highest attainable state of one's maybe mental, it could be physical, it could be psychological, it could be any other form of well-being. And this kind of well-being is determined by so many factors. It could be the genetics, it could be your housing, it could be the food you eat. There are so many things. And so to be able to get that comprehensively as an individual, you need to ensure that everything about your life is well at play. And this means that definitely the kind of services you get are not just about your body alone, but also the contributory factors to ensure that these factors enable the service to be accessible. It is physically acceptable, rather it is physically accessible, but also at the same time ensuring that you have it as an accountable system. You have it available, you have it of quality. And all these aspects mean that it's not about government alone, it's also about the individual. So what do you take in as an individual when you eat? What kind of house are you living in? What kind of transport system enables you, maybe ambulance or public transport, to get to a health facility? And
what kind of air am I breathing?
What kind of air are you breathing? What is that kind of environment? So there are so many actors at play here, and there are so many factors influencing one's state of well-being.
The water that we are drinking,
the water that you drink,
around us.
Yes, so it goes even as far as education. What is the kind of education that you have as an individual to understand who you are, what you need, or the doctors that are going to help you out? So it is the food we eat, it is the schools we go to, it is the hospitals, it is the houses. All these at play enable us to get a very good health.
All right, so when you talk about those things, to me it sounds like it's not only the Ministry of Health that then should be concerned about the right to health for all Ugandans.
Definitely.
What are the other supporting sectors that we need to also encourage to observe right to health as something that should be embedded in operation and in planning?
That's a very interesting question. Of course, you see, people usually think about health from a clinical perspective, and there are many non-medical factors at play. And these mean that you need to have a systemic lens or a systems lens to health. And that systems lens means that you track the pathway or the journey for one's health. And it means that what you eat means the Ministry of Agriculture has to come into play. How you travel to hospital, the Ministry of Works and Transport is at play. The commodities that you use that are not necessarily on the essential medical list, could be those that you have to access and could be subjected to certain levies, and so the Ministry of Trade could come in handy. You find that when it comes to sanitation, the Ministry of Water and Environment has to come in. So all of these are innovatively aspects that we have to look at. But most importantly as well is that health inequalities have a bearing that comes from a poverty angle. And so the Minister of Finance has to make sure that when allocating a budget, equity issues are considered for people who can't access a service. So in many ways, health financing becomes very critical to ensure that eventually even those who pay the service out of pocket and are not insured in a way can have models through which they can at least access the minimum service package.
Okay. Of all those that you've mentioned, let's talk about how they're actually contributing to injustices and not having equity across the bar as far as health is concerned, especially where it needs to be paid attention to.
Yeah. You see, like we've said, there are components of health that might not necessarily have a direct impact on you as an individual. And so when you are in a hospital and are unwell, that's when you believe that, oh, well, something has to be done about me. But we need to look at both the preventive and the promotive aspects of health before we get to the level where we're unhealthy. And so it means that ministries, departments of government and agencies have to ensure that even in their own planning on a periodic basis, they are able to understand the implications their mandate has on human capital development. So if you are in the Ministry of Works, make sure that the transport and infrastructure to health facilities is available. Make sure that maybe even the pedestrian walks are not posing health hazards to the population. If you are in the Ministry of Water and Environment, make sure that water is not contaminated. If you are in the Ministry of Agriculture, make sure that you look at the kind of agricultural inputs or even the manner in which food is being processed, or the way in which you work with the Ministry of Trade to ensure that the products on the market are actually consumable without causing health hazards. So in each of these ways, there are ways that we can improve one's health. You can even look at aspects of the mental destabilization that someone gets because the environment is not really according them the best standard they would wish. And so if prices are very high, if commodities are not accessible, it could create trauma for someone. The Ministry of Education is quite critical here because people and their mindsets have to think through what it means to know that even while I'm sick, I can access a service, or even while I am not sick, I can do a bit of self-care to prevent myself from getting ailments that could be preventable by, say, my lifestyle. Okay.
Well, Mr. Mganzi, you have mentioned ministries, departments and authorities, but of course the government does not operate alone. It does work hand in hand with the private sector. Where does the private sector come in on this conversation?
It's an interesting twist you brought in, and it is very important. When you look at statistics, at the moment, much of health service delivery is provided by government, but when you get to the many quality services in health that we want to have, you might not easily afford or get them through the public health system. And so you have to get through the private sector, or what you could call the profit oriented service providers in health. And so there must be a mechanism through which even be it the legislature, be it the regulators, come into a conversation with the service providers to see that quality is ensured, availability is ensured, but also that subsidies can be given to some of these providers, because this is a role of government to provide a health service, but the private sector comes in handy. And so the private sector also must be able to feel the corporate social responsibility, because health is not so much about profit making. It is interesting where you may think that you are well, but then the other person who is not well contaminates you or infects you. So if you are heading an institution and you have someone who is serving you tea and they're unhealthy, you could have a communicable disease. And so it is important that all of us make sure that no one is left behind. And that is the criticality of health for all of us.
All right. Yeah. Mr. Mugans, of course, custodians being the government and its different ministries and entities, it begs the question, as SEHAD, the backbone of it being that you are focusing on health and the various other rights, and also development of environments and programs and initiatives that can support holistic enjoyment of those rights. What challenges have you encountered with the different MDAs as far as pushing this agenda forward?
Yeah, I think the challenges are that in most cases we all know what it has to be done to ensure that there is effective service delivery. Even for many of these entities, they know what their role is, and they do play their role very well. But there are usually restrictive legal and policy frameworks within certain aspects of, say, health service delivery. As an example, you find that the law might not be as relaxed on certain forms of ailment or certain forms of lifestyles or certain forms of attitudes that have an impact on health. And so there must be a consensus between the policymakers, but also for the rights holders to agree on the clear pathway for which health is attainable equitably. And so usually there are challenges when there are misunderstandings, when there are varying viewpoints, and that requires that we really think it through in a manner that respects everyone's views, but at the same time has a critical agenda. But the other aspect is the financing. You realize that even while we have so many ambitions, there's usually very little financing to help in ensuring that we give the comprehensive health package as ought to be for everyone.
All right. As SEHAD, you have sat down and realized that we need to have another Uganda National Conference on Health, Human Rights and Development. Talk to us about that. When is it happening? Who are you wanting to attract on the table, especially based on what we've just discussed?
When you look at many of these challenges we've mentioned, or even the opportunities that there are, it means that consensus has to be built around what is the right to health and how do we bridge the gaps that exist across various sectors. And so SEHAD, for the second time every 2 years, has been able to organize a conference, the Uganda Conference on Health, Human Rights and Development. So the first one was 2023, and we have 2025, which has a pre-conference starting tomorrow at Mistil Hotel here in Kampala. And so it will be from tomorrow until the 5th. In this conference, we anticipate that development partners will be part of us, the private sector, the general public, beneficiaries of our services, the ministry, and its other comparator MDAs. So all of these we hope to come and be able to sit with us and dialogue on the future that we want to see that enables equitable health for everyone. Okay, how do we get access to this information? Am I invited? Registration is available online. UCHD. .ug is the website where you can go and access this information. Everyone is invited, or you're very well invited, and I believe you're even already on the program. So we really want to encourage everyone to come and join us. Of course, you are going to be part of us, and you'll be able to usher them into this conference in the opening ceremony. So in this way, we believe that at the end of the day, we shall have a contribution or a declaration that we can make that addresses many of the challenges that are existing, because amidst the current challenges we're seeing, the global trends, the donor shifting. Such a conference is inevitable, that we all know it is not a role of the health sector alone, but it starts from us, the individuals, and goes to every other duty bearer.
Okay. Richard Muganzi, thank you so much, and also to Sehed for coming up with this initiative, and is calling on all stakeholders, public and private, to be in the same room to realize that we all get to contribute to the right of health for every one of the 45.9 million Ugandans out there. For more information, you can turn to the social media platforms and get to see how you can be a part of this conference.